See, if people they are aware what is a heat wave, is when the IMD or the Indian Meteorological Department, it classifies into a heat wave is when consistently for over a period of time the temperature which is supposed to be normal, it is above 4 or 5 degrees above normal temperature, and it persists for over a period of time, say about 5 to 7 days. Then only they classify that yes, this classifies into a heat wave, and based on that they raise their alerts like yellow alert, orange alert, or the red alert. So but for a common person or a layman, if the temperature is also not, I would say, suppose sometimes you have temperatures varying in the range of 44 or 45 degrees centigrade, but you feel the heat is upper, like the temperatures ranging in the range of 50. So that if those kind of symptoms are, or the weather is prevailing, then we need to educate the society or the citizens of that particular city, or on a larger state or the country, that yes, we need to be quite alert and we should be watching for any unusual symptom which is affecting our health. And if at all we get these symptoms, immediately we should address these with by going to a doctor or a clinic. See, if you look at anything or any disease or any thing does not precipitate acutely other than neurological or cardiology, we take it apart, then what is on a milder, it gradually happens over a period of time. It does not start, it will always start with milder symptoms, like people may have lightheadedness, they may complain of headache, or they may have muscular cramps, or they would complain of generalized body ache. These are milder symptoms to begin with. Then other part is that patients, these kind of patients, sometimes dehydration starts precipitating silently also. When we don't feel the thirst and body is losing continuously water through our skin by means of sweat, or while breathing we are losing water and we don't recognize it, since we people we remain in environments which are either air conditioned or otherwise, so we may not realize these symptoms, but the system is getting dehydrated. So in these conditions, what one can observe, maybe if the patient is not observing, their caregivers or their family members can also observe that they may have dry lips, their tongues are dry, the skin is absolutely dry, and these are symptoms of dehydration, which if the patient, maybe I would say, if they may be children or the elderly who might not be in a state to express, then the caregivers or their family members should watch for these signs. So these are the initial signs which start precipitating in. Once these have precipitated, it has already the body is experiencing and still the dehydration part is continuing, then what is going to happen is that they may get worsen up. Patients will start having giddiness, or they may transiently be having recurrent episodes of loss of consciousness, or they start developing fever which is of rising trend. In harsher symptoms, patients may be losing appetite, they may start complaining of vomiting, or if it may worsen up if someone is having symptoms of gastroenteritis, like they may have diarrhea also, and the worst part can be patients will start having seizures. So these are very important signs which people should be looking out for or watching for. See, I would say that there is a guideline by the European Society where they say that every individual should take fluids in the range of 2.7 to 3.5 liters in a day, but that is not a benchmark and it is not applicable for everyone. People should at least, who have more of I would say physical exercise, or people who have got more work to do during daytime, they are exposed to outdoor environment or the extreme heat conditions, they will, and who sweat more, so that means they are losing fluids. By losing fluids, we mean that we are losing very important elements from our body. We are losing sodium, we are losing potassium, we are losing chloride. These people, they should continuously start replenishing it by water or by fruits which are healthy and which are rich in fluids, like the melons or the watermelons or any seasonal food, because the seasonal fruits, they are not only helpful in replenishing the fluids, but it provides us vital nutrients and minerals as well to keep the regulatory mechanism of the body intact. Besides that, it should be a thumb rule that we should usually watch out for the color of our urine. If it is not crystal clear but it is slightly yellowish in color, that is acceptable. But if it is worsened like that, it is extremely pale or darkly stained, we should realize that we are less on fluids and we should consume the fluids accordingly. So I would say that at least 2 to 3 liters of fluids we should take in a day, without even if we are not feeling thirsty. This is the bare minimum we should be taking on a daily basis. Other than that, seasonal fruits and vegetables we should consume, because they help in maintaining the regulatory mechanism where we can fight with these extreme weather conditions. See, making the environment cool is could be a big challenge, but yes, what they can do bare minimum is that they should take frequent breaks during the day. If they are working, say like farmers, if they have to work throughout the day, they can take frequent breaks during the day. They should work for an hour or two and then take a break for about 30 to 45 minutes where they take adequate amount of fluids. And they should, if they don't have ACs or the cool environment, what they can do is that these people can move into shady areas. They can take rest in beneath the trees or in any shady areas, temporary made shelters also. Besides that, what else can we expect from people who are living in rural areas? They should wear light color clothes which are loose enough so that it helps in circulation of air with the outside environment, and cover their body as much as possible. Then for a desi person, I can say that they practice also during peak summers in villages. They wrap around a cloth around their head and neck. They wet it so that the body remains cool and it is not exposed directly to the sunlight. So these are things which they can do at a local level or in the rural areas in the villages. See, what I can say is that it is not self-medication. Self-care is the best care what we can do. Keep yourself hydrated. Consume not less than 2 to 3 liters of fluids unless and until it is contraindicated because of any health reasons. Please do take adequate amount of fluids. Don't take sugary or aerated drinks. They on the other note, they dehydrate our system and requiring more of consumption of fluids. And try to stay indoors if it is not urgent. Please don't move out in extreme weather conditions. Don't move out in the sun. If you have to move, don't feel shy in taking umbrellas along with you, which can protect you from direct sunlight. And try to not only practice this but motivate others also to try to practice the same things. Not move out till these extreme weather conditions are existing. Thank you.